There are 30 million people in the U.S. who are dealing with diabetes, and by the year 2050, diabetes will affect 1 in 3 people. Monitoring your blood sugar levels is critical in dealing with diabetes, and technology is helping people do that, making it much easier. So joining us today is Dr. Athena Philis-Tsimikas, who is the Corporate Vice President for the Scripps Diabetes Institute, and Taisha Smith, the mother of 5, who has been dealing with diabetes for almost 2 decades. Thank you both so much for being with us. Dr. Tsimikas, let's start with the basics. What is diabetes?
So diabetes essentially is when the blood sugars are higher than normal in someone's body. That occurs because of 2 different reasons. One is the beta cell in the body that produces insulin might decline in function or stop functioning altogether. The other is that the muscles in our body may become resistant to the effects of insulin, and we need much more insulin to bring those blood sugars down. And if you're not producing quite enough, then those blood sugar levels again become too high.
And what's the difference between type 1 diabetes and type 2 diabetes?
It's a common question, and type 1 diabetes it's an autoimmune function where our body turns against that beta cell that produces insulin and destroys it, usually over a fairly quick period of time, maybe within a couple months. Type 2 diabetes is a combination of a decline in the function of that beta cell together with that muscle resistance, causing again, the effects of high blood sugars to occur.
And what are the symptoms of diabetes?
So the majority of the time, the scary part about this is that there may be no symptoms. It occurs so slowly that people don't even realize that it's occurring. So more commonly, though, we might see frequent urination, someone that feels very thirsty. They might be waking up at night to go to the bathroom where they otherwise wouldn't. And combined with that actually is eating a little bit more to try and overcome some of the effect of this polyphagia, too much eating, too much urination and dehydration.
Taisha, let's talk about you. You've been dealing with diabetes for almost 2 decades.
Right.
Tell us what was going on when you first realized you had diabetes.
When I was first diagnosed with diabetes, I was out of control. I didn't know anything about diabetes. I didn't know anybody that had diabetes at the time. And I was sinking really fast.
What were your symptoms?
I had frequent urination. I had excessive thirst. And I was dropping weight really, really fast, just losing a lot of calories. So I went to the doctor and had diabetes, and it just progressively got worse. I was seeking for help, and I just couldn't get a handle on it. My blood sugars were still going up. My A1Cs were really, really high. My blood sugars were ranging in the 400 and 500s all day, which is, very dangerous.
Pretty high.
What happens when it gets that high?
Well, if it continues to get even higher than that, you can eventually go into a coma.
Wow.
From that. But we know that high blood sugars also attach to different parts of our body. They can attach to the back of the eye, to vessels around our heart, in our kidneys, in our nerves, and can lead to some of the complications of diabetes that we know commonly occur as well. So for all those reasons, it's dangerous.
And you were also really depressed, Taisha.
I was very depressed. I couldn't get out of the bed and leave the house for more than an hour at a time. At night, I felt like I was dying. Like my body literally felt like it was shutting down. I had muscle pain, I had back pain, the eye pain from my blood sugar being so high. And I literally felt like I was not going to make it, And every night I would kiss my kids goodnight and tell them that I loved them because, I'm sorry, because I didn't think that I was going to be able to see them the next day. I felt like there was no hope. And I was trying to hold on, but quickly giving up.
So you come to the Scripps Diabetes Institute and you get enrolled in these clinical studies. That's okay.
Sorry.
You can that's all right.
Sorry.
And so tell us, in the past, monitoring blood sugar levels was kind of a nuisance because you had to prick yourself, right?
That's correct.
How has it evolved over the years
usual
to treat
routine
diabetes?
is that you have to use a small needle that sticks your finger. We ask patients to check 2, 3, 4, and if you have type 1 diabetes, sometimes 8 to 9 times a day. So,
And then based on whatever that blood sugar level read was, that's how much insulin you would have to give yourself.
correct, insulin or other medications. For type 1 diabetes, we use insulin. For type 2, it could be oral medications. But you use that value. It's important because it tells us how much medication you should be taking, how you should be adjusting really so much of your lifestyle, exercise, food that you're eating, so many things. Very important measurement for us.
So we have some really high-tech ways now that we can monitor your blood sugar levels. Why don't you show us what a couple of those are?
Aisha, you want to show them how you're doing it now?
Well, I am using the Dexcom G5, which is here. It is a CGM, continuous glucose monitoring system. And basically what it does is it monitors my blood sugar every 5 minutes without me having to do any of the finger sticks. And it transmits onto this little device here. And also, with technology these days, now it also transmits onto my phone as well.
So you can see what your blood sugar level is all day long.
I can see, it alarms me if it's going too high, if it's going too low, if I'm in a danger zone, and I can get up and act quickly. So this little baby has definitely made my life easier. I can't even imagine not having it at this point.
And show us some of the other devices.
So one of the other nice things that this can do is not only does it communicate to Taisha's phone, but it can actually communicate up to a cloud, and then you can transmit that anywhere you would like. So I have patients that when we're trying to adjust things are also giving me their numbers and transmitting what their numbers are doing, and I can look at that over the last 24 hours or so.
So you can follow your patients
and
up
I can
in the cloud.
follow my patients through the cloud.
Awesome.
So
Which is incredible,
Awesome.
so that you don't have to come into the doctor's office for the doctor to actually be able to see in real time how you are
You got it.
reacting.
That's
Yeah,
exactly right.
it's awesome.
Yeah. So it's really nice. Now, the nice thing about this device is they just came up with an updated version that doesn't require calibrations. This now requires you to check it twice a day to make sure it's accurate.
When you say that, what do you mean doesn't require calibrations? What does that mean? You still have
the
to prick
extra finger stick that's required to make sure that
Right.
it's equal to the number you're getting on your finger stick, and you need to enter it then twice a day.
So you still do have to prick your finger twice a day.
Twice a day with this. It alerts me every 12 hours. I have to do a finger stick on the monitor and put in the readings in here just to make sure that it is accurate.
That it's accurate.
Every 12 hours.
Yeah. But
And
the
you're saying now
FDA,
there's a new
though,
one.
that's right, the FDA just approved within the last week and a half
Wow.
their newest device. It's called the G6, and it does not require calibrations. It's smaller than this one. I'm wearing one right now just on the abdomen, which is the approved place to wear it. But as you can see from patients, they'll probably be trying it in a few of their own places. But
And you can test it out where you try it on different parts of your body to see that the read is still accurate.
that's the way a patient would probably do it. The way we're recommending is here in the abdomen and on the upper back area. So very exciting.
Yes.
In addition to that, there are a few other new reading devices, though, as well. I'm wearing another one. So this one is called the Freestyle Libre. And this one also attaches very easily to the body. And this one is pre-calibrated as well from the factory. It takes about 12 hours to warm up, but once it's warmed up, you also don't require any finger sticks for that. You simply turn on the monitor that you have, and you just hold it over close, and it gives you that reading with what the number is at that moment in time. And you can wear both of these for up to 10 days and not be able to switch them out. You can go in the shower, you can go surfing if you want, swimming. They stay on.
Definitely.
So it's very
Definitely
exciting.
Because this one is 7 days. So that one's 10 days, and I'm shooting for that one next.
Yeah.
And no having to prick the finger
And-
to calibrate it.
That's right. Yeah. So this provides us an enormous amount of information. These reports can come to me, so I can help the patient adjust their therapy.
And they don't have to come into the office to see you to do it. You're able to communicate back and forth
Correct.
via the readings on the cell phone.
Love it.
Now there's one other device that you have there.
So we have yet another device that delivers insulin in a different way. There's a couple different ways. Taisha is wearing an insulin pump right now, and she's wearing it up here on her arm. This is the one that she's wearing. It's called an Omnipod. We have a number of new devices now. This is the way you deliver it, but you would stick this on as well on the arm, and it's disposable. So after 3 days, you peel it off, right, and throw it away and put a new one on.
So that's automatically delivering insulin to her on a 24-hour basis.
It is, and then when you eat, you have to deliver an extra dose, and that's why she has her device here, where she has to deliver her extra dose at that time.
So is that showing you on that device when she eats what the blood sugar level is so that she adjusts the dose, or it's just an extra added dose?
So that's why you need this device to tell you what your blood sugar is. And there are now ways for these devices to communicate with the pumps.
That's awesome.
And the latest device is the 670G hybrid closed loop, which automatically makes some adjustments, although you still have to give yourself a dose when you eat. It turns itself off when your blood sugars are too low, and it increases insulin when your blood sugars are too high.
It's incredible.
It's amazing. It's really wonderful.
Talk about this.
So if someone wants a little bit lower tech and doesn't really want to use the pump and still uses a pen or to deliver their insulin, this pen is nice because after you dose it, you dial up your dose, you give your injection, it actually communicates to my phone immediately what the dose was and how much I gave, what time I gave, and then I can put in the amount of carbohydrates I just ate as well, and it will tell me if that dose was enough or not, if I need to give a little bit more or not. And then this also creates reports that are generated that can go to my physician's office.
Now, when you talk about this being a pen, that's something that you inject, right? You're injecting.
Correct. So this would go here, subcutaneous space with a really, really small needle. Yet another improvement that they've made, these incredibly small needles.
So tiny. It doesn't even hurt.
It doesn't hurt. That's just for people who are embarking on this journey, who are just diagnosed with diabetes. You know, they would be very scared about the pin, the prick, and you're saying it doesn't hurt at all.
No. If you're newly diagnosed and you're afraid of needles, this will be a good one because it's so tiny you don't even feel it going in at all.
And now there's also an inhaled device.
There is. So if you didn't want to take the injection, you just eaten some food or your blood sugars are high, you could take an inhaled puff of insulin with this device, which it requires just popping a cartridge in here with the dose. You pull off the cap, you take your inhalation, and it starts to work right away.
Wow.
So, yeah, pretty amazing.
It's amazing.
Yeah.
How have these devices changed your life, Taisha?
Well, I went from not being able to leave the house for more than an hour at a time to where now I can go out, I can be active with my children, we go to amusement parks, I can even work a job, without feeling down and depressed, and it's changed my life. It has definitely changed my life.
Has it made you more aware of diet and exercise as well?
It really has. When I first got it, it freed me up to where I was like, oh, I can eat whatever I want now because I just click a few buttons and I don't have to do all these pricks. And so I did that and I gained all this weight because I was just eating and taking insulin. And so then I hit a moment where I was like, you know what, don't take advantage of this, but use it for what it is. And it did make me more conscious of what I was eating. And I was actually able to get better control by having these devices.
How much weight have you lost?
So far, recently I've lost about 10 pounds. But I'd say probably overall, I'd probably say probably about 20 pounds.
Wow.
Overall.
Good job.
Yeah.
That's
So
great.
these devices have basically given you control of your life.
Definitely.
To be able to move through your life at the speed of your life without having to check. Talk about the convenience of that.
Oh my goodness. It is so convenient. I can get up and go and just like, she was saying, I can shower with it and everything. I don't have to take it on off. You get in a pool with it. It has definitely changed my entire life.
You're saying you can get in the pool with it, so you can actually go underwater with these devices.
You can go underwater with it, yes.
So it's freedom to go.
It's definitely freedom. And just to be able to push this button and say, oh, I'm in danger. I'm going too high or I'm going too low, and you can act on it, versus missing a lot of those lows. Sometimes you go too low and you may not feel it and you'll be in a danger zone. But these devices have definitely given me the freedom to just live my life.
That's extraordinary. We want you to hold this thought because this is all very high tech, and in just a couple of minutes, we're going to talk about some low tech ways to help you control your diabetes. So hold that thought, that's coming up. Dr. Tsimikas, can you tell us what's prediabetes?
So prediabetes is a condition where you're at risk for developing diabetes in the future. We have a few warning signals for it. But if you intervene early, you might actually be able to prevent the onset of type 2 diabetes.
This is type 2.
Yes.
So type 1 diabetes is not something that you can necessarily control.
Not at this time, although there are studies, which we are doing at our clinical research center and across the nation. We're part of a national organization that is looking at ways to prevent type 1 diabetes as well. It's called TrialNet. It's a study that's funded by the National Institutes of Health. And we'd be happy to walk people through that.
And so, yeah, you have, Taisha, you've been involved in a bunch of clinical trials with the Scripps Whittier Diabetes Institute. If somebody wants to sign up to be a participant, how would they go about that?
All they need to do is call us and let us know that they're interested in participating in clinical trials. We actually keep a list so that when we have trials that come up that look like they might be a fit, then we can call and connect people with these. And if they work, they're wonderful.
So the treatments for diabetes is what?
So there are so many treatments now. In the last 10 years, there have probably been more than 14 different therapeutic groups of treatment for diabetes. The majority of those have been for type 2 diabetes, but even within the options for type 1 diabetes, we have new kinds of insulins. We have even some of the pills are being tested in some patients with type 1 diabetes, and we've seen improvements. So there's lots going on. Lots has come out in the last 10 years.
How do you know if you're at risk for diabetes? What
Really
are the warning
best
signs?
Really, the best way to do this is to get a blood sugar value, and to do that at your physician's office or at a lab, and then your physician reviews it. So usually first thing in the morning, you would get a blood sugar value. If it's above 126, that's the number, the target that we use, then it's considered diabetes. We would repeat it twice, and if it's twice above 126, it means that you actually have diabetes. If it's between 100 and 126, that's the range for prediabetes that you asked about earlier, and that's when we would try and intervene earlier to try and prevent the onset of diabetes.
But what are the symptoms for prediabetes?
Essentially, none.
That's what's so scary about it.
That is what is so scary.
So is this the kind of thing that you would test for in an annual checkup? Is that part of your annual checkup with your primary care internist physician?
Yes. So that would be one of the tests that you take once a year. There is a simple paper test that you could take, or you could go online and take a risk test. And certainly if you have relatives that have type 2 diabetes, if you have had gestational diabetes during your pregnancy, if you are overweight, these are all risk factors that contribute to the development of diabetes. And if you score above a certain score, it means you should follow up with your physician and ask if you might actually have the condition or be at risk. But again, the way we actually diagnose it is through that blood test.
So we talked about this before, told you to hold that thought. Let's come back and talk about the low-tech ways to control diabetes, because this number that's very alarming by the year 2050, that 1 in 3 people will be dealing with diabetes, is that because of obesity in this country? I mean, how do you control diabetes or maybe prevent it? Mm-hmm. What are the low-tech ways you can do?
Right. So it definitely is related to the obesity epidemic that has occurred in our country. But in addition to that, fewer places to go out walking and exercise. We're being inundated with marketing of foods that maybe aren't necessarily the most healthy foods. And if you don't know what's in that and what might occur, so maybe a lack of knowledge around that.
Are you talking about processed food?
It can be hidden calories, it can be processed foods, it can be so many different things. Just the amount itself is a factor. When you look at a large, you walk into a restaurant, you get a much larger meal than what we ever used to get 20, 30 years ago. Mm-hmm. So that in and of itself is a problem. So we can intervene. We have a number of classes really revolving around education and educating our patients and our community around what this means, how to approach it a little bit differently, how to make better choices, and that can really lead to the prevention of diabetes. It's really fabulous.
Talk a little bit about Project Dolce and Dolce Digital Me.
Project Dolce is a program in the underserved community here in San Diego, focused really on Latino and other racial ethnic groups that are at higher risk for diabetes. And we went into community clinics and partnered with them and delivered and developed programs to educate and better manage their diabetes. And based on that, we actually found lower blood glucose levels, blood pressure, and cholesterol levels. We, interestingly, transformed the curriculum of that into a texting program. And we looked at if you text people these educational comments and then they send you back what their blood sugars are, could you improve their outcomes in blood sugar? And found that we could. So, so we are now translating that into the next step, which is if you take devices like these which communicate wirelessly up to a cloud and then send back more specialized text messages that are more appropriate to what their actual blood sugars are, whether they're taking their pills or not, whether they're feeling happy or not, because we ask those questions via text as well. If that works even better than just receiving the same text message over 6 months.
So that's the Dolce Digital Me study.
That is called Dolce Digital Me.
Wow.
Yes, it's an adaptive way
That's amazing.
to help respond to some of your approaches of managing blood glucose.
So you're really harnessing technology in order to make people more aware of what they're eating and how they're exercising to actually improve their health.
Absolutely, and in real time, which is what's the amazing part of all these devices that you can use now, that you can do it in real time when people are thinking about it.
Taisha, when you look down the road, what do you see?
I see a bright future. At one point, I felt like I was not going to make it to the next day, but now I see that I can live many, 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 many years. I don't see myself stopping anytime soon.
I know there was a point that you said that some doctors said you would never see your kids graduate. Is that correct?
Yes, that is correct. I've had doctors tell me my diabetes was so bad that if I didn't make a change right then, that I would not see my children graduate. And now all my children have graduated except for one, and he's got 2 more years.
But you're looking down the road, way down the road to seeing, to playing with your grandkids.
Yes. I look forward to it. I'll definitely be around for it.
And what advice would you give to other folks who have diabetes?
I think the advice that I would give for other people is diabetes is hard. It's a very hard disease to control, but it's not impossible. And just to let people know that you are not alone. You don't have to do it alone. Scripps is here. They have the resources and the technology. And if they did it for me, they can do it for you.
Dr. Tsimikas, what advice would you give to folks who are dealing with diabetes?
I think the best advice is to get educated around your disease. I mean, we've seen from Taisha how much she's learned and is has the motivation now to manage her own disease, and that's really important. But partnering with your physicians and with your educators, your diabetes educators, and we have such an amazing team here at Scripps. That really works so well.
Yes.
Thank you both so much. We wish you continued good health, Taisha.
Thank you.
You come back and show us pictures of your grandkids. Okay,
I
when
will.
that time comes.
I will.
Scripps takes care of more than 27,000 folks with diabetes across San Diego County and is ranked by U.S. News & World Report as #1 in San Diego and among the nation's best in terms of diabetes care. If you are interested in participating in future diabetes research studies with the Scripps Whittier Diabetes Institute, just call this number. It's 858-824-5453. If you would like more information about diabetes care, just click on the link. And if you want more critical information about your health, we take care of you from head to toe at Scripps. Please subscribe to our Scripps Health YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.